Oh, wait.
Do you need help?
Unless you know how to difficulties here.
I know,
I
right?
don't know how to sit on
I can hold something up too if you need.
these. Can you hold the sign up for us the whole time?
I'll be the stand first.
This is something.
I know.
Where's my scenario for there?
Feels boring.
No,
Yeah, I know. I needed it. I needed it. You see? It was funny for a second. You were talking to everyone before. I thought you were starting and it was like 9:26. I'm like, yeah, she's starting.
And then we can put this up here.
No. You're right there. I think the dental. Yeah.
Yeah, good morning, you guys.
We also have virtual too. Here, I'm gonna move these. I'm gonna move you all. Come with me. Here we go. This is the gang. And can you all hear me at home? If you can, if someone could just like say
Yeah,
yes.
we can hear you, Trisha.
Oh, good. Oh, good. Thank you, Bridget.
Welcome.
And if you are just jumping on, you didn't hear me before. If you have any particular questions about any specific previous injury or whatever, you can drop it in the chat and I'll keep the tabs on it. There you go.
Ready?
Yeah, you take it away.
Okay. Recording too. Okay. So good morning, you guys. Thank you all for coming, hanging out with us. My name is Kate. This is Casey. We are both PTs at our East Norton location, which is just right up Germantown Pike. And this is Lisa. She's part of our marketing department. Are you guys familiar with Total Performance PT at all? So there's, billions of PT clinics around here. Total Performance is owned by Heather Moore. We have 5 clinics. Most recently just opened up in Harleysville. Second most recently in East Norton. So at this point, we're just trying to kind of get our name around in the area, down towards Plymouth meeting this area. You guys, this beautiful facility just popped up in the last 2 years. Has everyone been here for how long? How long has everybody been here? Year, just about? Okay, all right. So we wanted to kind of make this open-ended, but we have a little bit of structure to it. We're here to talk about joint pain, low back pain. I think we're going to focus a little bit more on the lower body. But we wanted to talk about pain you experience and sort of what to do to be able to identify what's okay pain to be pushing through, what's not okay pain to be pushing through, and ultimately things to be doing on a somewhat more regular basis to help take care of our bodies a little bit better, especially for you guys who are beating yourselves up on a somewhat regular basis in an awesome way. I heard you guys working your butts off in here 20 minutes ago. God bless you for doing that on a Monday morning. Start right off the bat, who has experienced any, let's go, knee pain, hip pain, low back pain at some point in their life? Yeah, okay. Are you still currently experiencing knee, hip, low back pain? Yeah? How about those of you who kind of sort of comes, goes, depends on what you're doing sort of thing? Yes? Okay. Anybody with more of a constant pain that's not really going away with anything? Okay, well, you'll be number 1 on our list over here when we're done. Yeah, we got you. Our first point, when you're thinking about things, pain in your body, stress on your joints, the first thing that you're going to ask yourself, is the pain reproducible? Meaning, things make it better, things make it worse. It's an easy way to determine if something is more inflammatory or abnormally stressed or excessively stressed versus something more serious going on. That's going to be the constant pain that no matter what you do, no matter what position you're in, it just doesn't go away. In that scenario, that's something a bit more concerning. You want to probably hit up your doctor in that scenario. In the first scenario, if it is reproducible, it's very likely able to be reduced. And maybe that starts with, well, I won't start, Casey's going to get into that a little bit, but that's what we call mechanical pain. Things make it better, things that make it worse. That means you're in a good camp there and very likely able to figure out ways to reduce that stress, which is 9 times out of 10 the reason for pain, abnormal or excessive stresses. So Casey's going to talk to you a little bit about pain. Go for it.
Okay. So typically when we as humans, as people,
have pain, we go through kind of this cycle that is 3 stages. First is, I'm just gonna ignore it, cross my fingers, hope it goes away. This phase maybe takes a while for you, maybe doesn't. Phase number 2, ignoring it didn't work. So now we go into a phase of, maybe I try some pain medication, maybe I try to back off of some of my fitness classes, back off of some of my workouts, that kind of thing, not going for hikes on the weekend. And then maybe that helps for a while, but then you try to get back to it and it flares back up, or maybe that doesn't help. But over time, you're realizing that you're giving up kind of more and more, and the problem isn't resolving. And if you've had pain that is lasting for more than 2 weeks, not going away on its own, and flares up more than twice, it's likely not going to go away on its own. So that kind of moves us into phase number 3, where we kind of recognize that this is probably something we need to address at this point. And in our healthcare system, that probably looks like going to your primary care, who maybe sends you to an ortho, and they could possibly do some testing, imaging, injection, that kind of thing, see what happens with that. More weeks and months go by, and then maybe they send you to PT and we get our hands on you. And so the whole point of kind of going over this cycle that almost everybody that walks into our clinic has gone through is, now they've been weeks and months out of the things doing that they want to do. Whereas if we could kind of break that cycle, get you sooner into physical therapy, we can get you back to doing what you want to do a lot quicker. And not having to go through all those steps. Not that we can't go back, we can't not go to ortho and get imaging or an injection, that's still on the table, but we can help to facilitate that with you in physical therapy. And our first session is just assessing if you're appropriate to be seen with us, if we need to refer out, that kind of thing. And then, yeah, that was all that one. Yeah. And then let's talk about the 3 most common causes of pain, especially in the lower body. Number 1 is arthritis. It's very easily diagnosed. X-ray imaging is the most easily accessible, cheapest imaging. It's very easily seen in that kind of imaging, so it's very easily diagnosed, although this commonly is not the main cause of pain. Because if you took x-rays of all of us in here, chances are you're going to see something somewhere, and maybe it has pain, maybe it doesn't. So we've seen a lot of imaging in asymptomatic individuals. That doesn't necessarily mean that the arthritis is what's causing your pain. Second is, especially in the knee, is meniscus tears. So sometimes in an active athlete, this can happen in one kind of fell swoop, or it can happen over time as a more degenerative process. And with that, you're going to see kind of pain with standing and turning, pivoting, that kind of thing. And with both of these cases in PT, we're not necessarily treating the arthritis or treating the meniscus tear, but we're kind of treating all of the deficits that maybe led to it or have kind of led to compensations, and trying to prevent more compensations and more issues down the road. And both of these diagnoses doesn't mean a future of imaging and injections and surgery. Most people do just fine without more invasive interventions like that, and do really well with conservative treatment like physical therapy. And then the last super common one that we see is more of a muscular issue, which is tendonitis, especially in the knee. You see it right here. And then coming from the hip, your IT band up here can get you down in here. And that is likely a result of tightness or weakness, whether that's at the hip, knee, foot, ankle. Everything's connected up the chain, down the chain. If we can address what the underlying cause is, chances are we can get you back to doing what you want to do and resolve a lot of that pain.
Yeah, just to go off of what Casey's talking about, I mean, you guys are doing squatting, lunging, deadlifting, overhead pressing, like all of those movements are sort of integrated into your classes on a somewhat regular basis, yeah? And we saw how many people raise their hands, the hip, knee, low back pain. So just to give you an example, I mean, something like your workout classes where you're doing these on a 2 to 3 time a week basis, in a somewhat repetitive fashion, and like you said, all of you have raised your hands at some point in time. Anybody who does that sort of thing repetitively, it's not bad by any means, but things that are going to get you into trouble is, even Trish was talking about this early, she's guilty of it, ramping up too quickly. That's probably the number 1 reason why people start to develop pain. You go from 0 to 100 way too quickly. The other thing that can get you into trouble, kind of going off of what Casey said, muscle imbalances, or the way that your body just naturally moves. Our body's really good at finding the path of least resistance. Whatever is the easiest, simplest way to do a movement, the body will do it unless you're paying attention to it. So a lot of the time, like say I've had history, which I have, history of knee pain. My body's naturally gonna go into more of a hip dominant movement. So if you take a look at like something like a squat, if I have a history of knee pain and my body doesn't really want to use my knee as much, I'm going to sit my butt back a lot more. I'm going to use my hip, or I'm going to use my back. And I'm sure if you think about like looking around the room at the way people are moving, not everybody's squat looks the same. Some people sit back a lot more. Some people you see their trunk go up and down. In that case, you're stressing your back out and you're using your back more to accomplish a movement because maybe your hip and maybe your knee aren't wanting to participate in the party. If the back, hip aren't wanting to participate in the party, then you see more of this, okay? So not one of these movements is necessarily wrong, but if you have a history of any sort of muscle strain or sprain or tendonitis and you just are always performing these movements in this type of fashion, then you can see like if I'm always using like this sort of strategy that's putting stress on my knees, my meniscus, my patellar tendon, my IT band, has anybody had pain in these areas of their knee, are gonna start to develop a lot of stress. So just so you guys can kind of get an idea of that. The other thing is, you develop pain. We talked about body's really good at finding the path of least resistance. The next question that people typically ask themselves is, okay, well, what do I do? Do I stop working out completely? Do I push through the pain? I don't really know what to do. A lot of time when we see patients, which is usually like 3, 4, 5 months after they've had the pain because it won't go away and we try to ignore it, but it doesn't go away. They say either I stopped working out because I was scared, I didn't really know what was safe to do, so I just took everything off of the plate. That sort of inactivity, that sort of modification, no good. I mean, 15, 20 years ago, the treatment for any sort of injury was splint it up, don't move it, put ice on it. At this point in what the way that we're explaining treatment of things, the complete opposite. You want to be moving as much as you possibly can. Icing, we're really kind of getting away from. Has anyone heard the update on this with icing at all? No? The newest thing with icing is, the biggest thing that icing does is it constricts. It constricts your blood flow and limits the amount of blood flow going to the area. So I think at some point, one of our healthcare providers in our whole system took a step back and said, well, why do we want to be limiting the body's normal inflammatory process to something that's irritated? So we're really kind of getting away with that. We want the body to sort of heal itself with that increased blood flow to the area. Again, going against everything, we were like, you sprain your ankle, lay down, get it up, put it in a splint, do not move it for 8 weeks, and maybe don't even put weight on it for 2 weeks, bad. Do not do that. That's the worst thing that you can do. Going towards the other side of everything, well, it doesn't hurt that bad. Like I can still lift my leg up and go up and down the stairs. I'm just gonna do everything 100% and not modify at all. I think that that's the minority of people, but there's the people who are like, you know what, I'm just gonna put my head down and hope in 3 weeks or 3 months that this goes away, right? Balance of activity, very important. And I think I heard one of your instructors saying like modification, huge. So it sounds like you guys are integrating that within your classes, which is great. Just because Susie so-and-so next to you is doing the big deep squat with it, doesn't mean you have to. I think naturally all of you guys are probably on the more competitive side. So you want to you're trying to keep up with everybody. So that's the other thing. So balance is really important. Do you guys have any questions about that or anything that we've talked about at this point?
That ice thing kind of blows my mind.
Yeah, great. Well, how is that just because that's just what you've always done?
Oh
or?
My God, yeah. I mean, I coached and that was always.
Throw ice on it, throw ice on it.
Icing was always it. Yeah, it gives you temporary relief. Right?
Yeah.
This was the only thing that, I had sciatica pain when I was pregnant,
Mm-hmm.
and I had 2 kids to run after, but I couldn't do it.
Yeah.
And the only thing that would give me any sense of comfort was ice.
Uh-huh.
Otherwise, I was just I couldn't.
Yeah.
I wasn't pain sitting, standing, everything.
Yeah.
Like,
Well, and that's a good point, because that's literally the only time I tell people to ice.
it's sciatica.
Well, no, if it's the only thing that you get that gives you relief, if you get that temporary pain relief, fine, do it. But outside of that, you're really just trying to stay moving. And pregnancy is a whole other bear. God bless you, mama. But yeah. But yeah, I mean, if it gives you some pain relief, fine. But if you're thinking about like what's going on inside your body when you're putting that ice on there, yeah, you're really sort of disrupting the body's normal response to that, which is not necessarily what we want to be doing.
What about heat? Like
Heat it up, baby.
Okay.
Heat it up all day, every day. Not necessarily, but yeah, heat. 10 minutes on, 10 minutes off, especially if you're dealing with something that is maybe, like I would have said, maybe try the heating pack with the
Thank
sciatica.
God I'm not pregnant right now.
Okay. But yeah, heating definitely. And even like the anti-inflammatories, that's another question to ask yourself. You guys are all young, you're all healthy, you're all fit. This is when you guys are sort of taking for granted and that you have such healthy bodies that bounce back. 20, 30 years from now, your body is not as forgiving. And I hear this, how often do we hear like,
Don't get old.
don't get old, that's all we hear, because we see a lot of like ex-athletes, ex-super active people, and they're just like, it always catches up with you, so if you feel, like Casey said, like if your knee is flaring up every couple of months, your shoulder's flaring up every couple of months, but it always goes away, just go take care of it now. Go to a PT, or go to a PT, have yourself evaluated, and see what they say. That's something that we always like talk about. You get a yearly physical, more of an internal examination. Everyone should go to a physical therapist, have some sort of like mechanical evaluation, look at the way that you move, any sort of compensations. Are you using more like a knee strategy or a hip strategy? Like let's change that now so that in 30 years, that hasn't exceptionally caught up with you and really causing ruckus with the hips, the knees, the low back, that sort of thing. What was I, any other questions? Yeah.
So for me personally, I work that flares up every 4 to 6 months.
Aha,
And
okay.
my way to, I guess, patch it is a chiropractor fixes me
Yeah.
every time, then I'm back.
Yes?
What are your thoughts on going to a chiropractor versus really investing your time into going on a regular basis to see if this is something that?
We are not, we're advocates of chiropractic, but we would probably make the argument, well, why is it continuing to come back? They have a place, they are a tool in a toolbox, but if all you're doing is chronically going to the chiropractor to get adjusted, well, there's a reason you're going out of alignment. There's a reason why one leg keeps getting shorter than the other, which is oh God, I went to the chiropractor and my leg was 2 inches longer than the other. You didn't just, yeah, we hear that a lot. So the ideal scenario would be go to your chiropractor, then come to a PT, let's evaluate and figure out, or even let's do this before you go to a chiropractor, evaluate how you're maybe misaligned and maybe using muscles in a compensatory way, which is causing that imbalance. So yes, but I'd say come on down over here, let's take a look at you, which would be able to maintain that. That's, low back pain is very commonly, it flares up once, twice, maybe 3 times a year, and then it goes away. You rest, you relax, you modify your activity, and then it comes back, exactly what Casey was saying, but it usually comes back because it's probably caused by the way that you're holding yourself, the way that you're moving, whatever sort of like strategy you're using when you're doing like repetitive movements, even something like getting up and out of a chair. And what happens is you modify your activity, you're very ginger with sort of how you're getting around for a little bit, and then it goes better, and then you go back into all the bad habits, right? Sorry guys. So, PT, the goal, a lot of the time with PT, the goal isn't to like completely abolish pain forever and ever and ever. It's to teach you how to, number one, listen to your body and pay attention to it, because with flare-ups, with whatever part of your body, there's usually little warning signs. Maybe it's your knee starts clicking and popping, or maybe, you even know like, oh, I twisted to turn that, and ooh, I definitely feel it's not terrible, but like, usually you can tell if you start paying a little bit closer attention that something's gonna start getting really angry and irritated. And then the other thing is a lot of the time, maybe you've even done stretches for the sciatica while you're in a flare-up, but do you do it when you're not hurting? No. Nobody does exercises for certain parts of their body unless they're reacting to the pain. It's common we get very reactive with our pain instead of proactive. So pain or no pain, I'm gonna do these, the way that I work out, I have shoulder problems, I got a hip and I got a knee problem. And we both have talked about, if we don't do a regular exercise regime for activation and muscle strengthening, our bodies will hurt. And then we go, look, you lazy piece of crap, go back to the gym and do your exercises, because it's, maintenance. Maintenance is so important. We think we can live our whole life without having to take care of our bodies at all, and we'll just not have any pain. So it's important to understand the value and the importance of taking care of yourself, taking care of your shoulders. For example, with our shoulders, we all do this all day, every day. Maybe every so often we pop up and we pull our shoulders back, but yeah, see? You're like, oh crap. So inherently, if we do this all day, all of our rotator cuff muscles, our shoulder blade muscles are always in a lengthened position. They're always stretched out. So our shoulder blade and our upper back are always inherently a lot weaker. Same thing when we sit. When I sit like this, and probably move something like this, our hips, the front of our hips, very tight, and our glutes, again, elongated, and again, much weaker than the front parts of our body. So we kind of talked about those muscle imbalances, certain muscles being stronger than others, and the way that we're putting stress on our bodies. Just because of what we do every day, because we have to work, and a lot of us do have to sit at a desk, it's so important to be trying to maintain a certain amount of strength and activation. And again, 9 times out of 10, it's the back parts of our bodies, right? Does anyone do anything like that at this point? Now, can you guys think of anything you do on a somewhat regular basis to sort of try and maintain a certain amount of flexibility or strength? Foam roller.
Come to remix.
So that's part, before all of your classes, you guys are doing warm-up activation exercises sort of thing, which is great. And from what I've read up with you, I'll have to come and check out a class. I'll see the class. You guys do it the right way. There's a lot of classes that you see that don't necessarily follow a nice warm-up activity cool-down pattern. But my only caveat would be, it's the same. Everybody's different. Everybody has different body types. Everybody needs something a little bit different, just based off of how they move or how they hold themselves or what they do on a daily basis. So again, going back to the note, yearly PT evaluations, everybody, I think that would be so good for everybody, especially people looking to maintain a certain amount of activity level throughout their life. What else? What other questions do you have?
First one, do you need a script from your doctor for?
Great question.
No,
You don't.
Okay.
no, we'll communicate with them and take care of it.
And then my second one is, for people with muscle imbalances, obviously I know you do maintenance. How long do you typically see, how many sessions does it take until somebody kind of transitions?
Everybody's different. A lot of the time it depends on how long, how chronic it's been going on. That will often take a bit longer. And it also depends on how compliant you are with your stuff that you're doing at home. If you're on it every day doing your stuff, I know, let me just come to the.
I was like, I'll just move it. Make sure if
if
there's any questions at home too.
Yeah.
I don't see.
If you're consistent with doing your stuff at home, you're feeling good about it, it likely doesn't have to be quite as long as maybe somebody who needs a bit more help through that process together. But you guys are super active individuals, and I'm imagining would be super on it at home and motivated in that regard. So we likely wouldn't have to see you for as long, but keeping a regular program for a fair amount of time after we're done seeing you is a good thing to do. Good question.
And a little fun fact about it takes 2 days to see an appreciable loss in muscle mass. So that's what we call atrophy, right? So that's a perfect example of you don't use it, you lose it, right? So if you stop moving, that's why they've really gotten away with, you have to maintain movement with or without injury as much as you can. 2 days to see a muscle loss. It takes 6 weeks to see the same amount of muscle gain in that same muscle. So we lose it so much quicker, and it takes hard work and consistency to see the gain back up. Yep. What else? Any other questions?
Say you have something like tennis elbow. So, and you said, don't just sit and do nothing, keep moving it. What would you do? Because it's painful, obviously come to the PT, but if you're in class, how should you keep moving it so it's not painful, and how do you know, where I'm taking it too far, exasperating it?
Yeah, so a certain level of pain we're okay with, but if you're continuing to go and it's just getting worse and worse and worse as you're kind of going throughout your class, that's maybe time to take a step back, modify a bit more. Or if you're doing activity and afterwards you're down and out for the rest of the day, you can't move it because it's so painful, or the following day also, again, maybe time to take a step back and modify.
And there's something called like the soreness rules. Hour after you work out, you're still feeling some sort of pain, achiness, dullness, sharpness. You either you overdid it, or maybe it's time to go to the doc or come to a PT to have it evaluated. But I would first recommend try and modify your activity, like with a tennis elbow or with anything. A lot of it is like movement, going through the range of motion is probably not going to be the most good feeling. It's probably going to hurt, right? So trying to modify, finding positions of however bend or flex your elbow needs to be, or messing around with the position of your palm. Try and maintain a certain amount of activity, but try and mess around with different modifications of the activity to be able to continue to perform. Yeah. What else? That's what else.
So under the muscle imbalance umbrella, there's the back and the ab muscle. Does it fall into that? Because I feel like my abs are not strong enough, which I feel like they're not, it compensates the back pain. Is that true, or is it a story that I
Yeah.
myself?
Yeah. But like Kate mentioned as well, glutes are a big part of back pain as well. So yeah, core and glutes. Yes, that's kind of the one spot where we do, with all our back pain people, we're still doing core exercises, just probably a little bit more focused on some of the deep core muscles that get a little bit neglected.
So something like Pilates may help with that?
Yeah. Pilates and yoga, and I mean all these classes are integrating core. You can make anything a core exercise, but just by being mindful of how you're holding yourself. The reason why, and everybody's different, but the reason why usually low back happens is, and I'm guilty of this too, we fall like this. We like to hyperextend, and we like to kind of push our pelvis forward, which you can see, same concept, length, it's gonna lengthen my abs, it's gonna put them in a much harder position to activate. So if you can further be mindful of, neutral spine, that's the goal with Pilates. I pull my shoulders back, I tuck my pelvis in, and I'm really trying to maintain a flat and straight angle of that spine when I'm doing things. But also, it depends on the person. It could be a matter of if my glutes are weak, what my glute muscles do is they push me forward, or they power me up when I'm doing a squat. If they're weaker and not participating in the party, a lot of the time it's the back. That's where you get that shit, the back tries to extend to get yourself to move forward. And obviously you don't see a lot of people moving like that, but it's a much more subtle compensation. But that's gonna create a lot of tightness on those big back strap muscles, and then in turn create a lot of a compressive effect on the joints, on the discs, and then that's where you get sort of you can get the sciatica pain, or you can just always have sort of a dull achiness in your low back. It depends on the person. Yeah. What else? Any other questions?
I have questions, but they're very specific, because I've
Yeah.
4 kids in 6 years.
Oh my goodness, God bless you. Yeah, so that's where we, if unless there's any more general questions, we wanted to open the floor for some consultations. Let's have a look at some of you, see what we see, and then maybe, or unless there's any questions on there.
Yeah, I'm seeing on it.
Okay. Yeah, have a look. We brought some tables. We even want to get our hands on you, dig out some areas, and kind of show you the benefit of some of this more regular activation and stretching activity if you guys are interested. Yeah. So if you are interested, I just need to you guys come on up, and you're just gonna fill out this consent decree. It just lets us dig you out, and if we bruise you and make you sore, then you sign up for the contract.
I think I see.
Yeah, if you guys
Let
want
me
to all
see.
kind of, I'll give everybody their own little spiel if you guys only want to listen into.
Oh, thank you, Jen.
Talk with you guys about.
Carolyn, Kristen, and Dana, if you have any particular questions, let us know. I'll give it a couple more minutes.
This is great. I feel like a lot of times too, when we're doing, people will tend to have back issues when we're doing glute work because like deadlifts and stuff, because they're putting too much in their back.
Yeah. All right, you signed? Come on over, what do you got? What's the deal?
Alright, I'll start with me.
Okay.
So years ago, I had self-memorize, usually because I stopped doing stuff, it pretty much came back and I think sometimes maybe the bursts are here from it, I don't know if they're linked or not, but it's my left side of my body. So basically my left shoulder, I had years ago, my shoulder snap, whatever you call it. I think now, I don't know, sometimes not my shoulder, which has never hurt. I feel like that more, I think that it's like, where the tendons or.
Okay.
Now, I don't know. 2 kids ago.
Okay.
Okay, so my left side is up.
Yeah, and I mean, maybe you can make an argument it's related. There's some people who like to put all of that together, and that's not necessarily the way that I look at things, so, let's look at you separately. Go ahead and add your back. So, I mean, at this point, when is it bucket? When you're standing, when you're squatting, when you're lifting?
Stairs, squatting, lunges.
So I'm gonna say you say the
All
left.
from 11 cup.
My name's Casey. What's up? Nice to meet you.
All of the habits that make his mom, his brother's first wife, who's been married. It was a lot.
I hate those.
This may be another one of those like,
Oh my god, the burst are
So I noticed, it's fine, and I'm like,
Where's your
shopping.
area?
We are shopping. If it's the person here is a bit. Okay. And I'm like, oh,
Yeah.
so people don't have to try to like be like conscious of shit. And then I get into it and I start like, so it's bad.
I feel it all when
I know, it's bad.
because she was like,
Oh, hold
yeah.
here, right, don't let me press down.
So
So you're gonna hold right here.
it's like, it's
Oh, okay.
so she's like,
That really.
yeah, I just want to like, I feel like my shoulder.
Yeah, that's what I'm gonna look at.
Yeah.
It's actually pretty straight, so
Yeah.
it's good. Don't let me
Like,
like,
if I go like this,
Yeah.
it hurts my
turn on
back.
your side,
Yeah,
yeah.
or like this, like.
Keep your knees bent. Good.
Like that.
I'm just gonna just top knee up here. Hold there, don't let me press down.
If I squat,
Listen,
So that's a huge, it's a huge one. Yeah, relax here, relax, lift your foot up. Good. Hold here, don't let me press down. So that, what's that?
Yeah, I feel it.
Yeah, just based off of this like strength session here, I would say the hip is probably a big hold. Hold here, hold.
It's so fun. Wow, sure.
Yeah,
Good. Any pain down or not too bad?
Not so bad.
And then same thing with the back.
So I'm
Like,
happy
I
to
really
because I did the same thing.
Yeah.
And,
19,
right.
like,
She's like,
a lot of the time, she's 27, she's already had the boys that
Hurts, yeah.
Especially now.
So I'll think this is out. Do you have a foam roll? Do you stretch your hip bone at all?
I don't.
No?
But I do have a foam roller. I've never really used it.
Yeah, that's my opportunity. Well, so for you, glute strength, and on top of stretching, so you would be the one, a perfect example of, okay, look, like, so you just need to get set up on a 3 times a week, I do 5 right now, like sitting in the and a bit I lay on the side. You just need a bit more specific.
You're good.
You said I'm not gonna look at you. I think right in the middle, like you are very strong in some areas.
That's exactly how I would describe myself.
That's the perfect example of muscle mass, right? So
Yeah.
you just need a little bit more, again, specific exercise on those glutes here. I'm just gonna take this out a little bit more. When you're foam rolling or using that tennis ball, this is the type of pressure and the type of.
Even that already comes a little bit.
You want that mobility, it's not painful.
So
Yeah.
honestly,
Right? But in PT, this is something I spent like 30 minutes of my patients.
Okay.
And then you go and strengthen it.
Okay.
You let me know if I'm missing something.
I know.
Alright, let's get this gentleman, and then I'll take a look at your shoulder next time, okay?
Okay, thank you.
Alright.
I'm Kate, by the way. Alright, you're not
Pretty much.
Thank you so much.
productive,
recently.
nice, good,
No,
preparation.
no,
Stretch it all.
vacation.
I was gonna get her.
Yeah, feel okay. Okay, yeah, so you've got the range. I was gonna think that they're tight, honestly, most of the time. Yeah, it's kind of like,
Well, it's, as been really consistent, and you ramp it up every
My program, it gets to be, but you have to write that. It just makes it
Yeah, that's awesome. Good for you, man. Yeah, that's awesome. So really your body's going to see Can you like push on it? One like I asked earlier, like, can you, things maybe if I do
No, I
like.
actually worked out today with it.
I mean, it sounds like you're in the, it's good that you're three. I don't think you need much of that, that's actually. So that will, I mean, it may just be a little straight. It's not necessarily getting. So this is what you do right in here. Get your thumbs and dig it.
Stay in less than 5.
Okay.
That's where we want to be, and then again, we talked about it. You're going to in front of there, in your exercise class, and it's just getting worse.
It sounds like, if you want, actually, I can use the tools on it.
Yes. That's elevation, you're more down here than you are up here. Or, weight is right, and easy to go to.
Because I have that ability for my kids to go to school right away. When I feel like it's like there's like this, I feel like I feel it like right there. I know that. A lot of time. So I never like I said when I was using it.
Yeah.
I can't kind of slow down. And then
Sometimes I feel in my shoulder.
I need
And that's, and they're just trying
I've said to my dog, I've said to my daughter,
Sometimes I feel tapped out just a little bit.
And that's one of those things like, if they take an X-ray,
No, the guy who did it 5 years ago.
And I just wanted to have it and rotate it
That's when
That's great. Wow, Well, that's what, just keep your core strong.
Yeah.
And you only have so much control over that, especially if you're something like that. So, you're doing a heavy lifting.
I stopped now.
Okay.
I'm just about.
Okay, great. That's like, I would say that's a super. Alright, come on up. So with that, I mean, if you're doing, like I said, once a day, okay? And you ever try to sucker out?
Yeah, I have.
Yeah. So with this, I mean, with my digging, you'll probably be sore for a leg. About It's all, it seems very tender. Yeah. So I would say, I mean, give it a chance. Take it down, but that's in the presence of digging it. Chris here's just because he wants to talk, so. This is not
That's for like.
You're start.
He's not, yes, so we're about 15 minutes, well, 10 minutes of Georgetown. Are you looking to have a look? What was that?
Even just standing, sitting,
And where did you sit in
I just all of a sudden got it.
to get it.
It's just always there.
It's here.
And it's not gonna be.
Okay.
And I find the more active I am, you just get me,
Okay.
I'm just sitting too much.
Okay.
Why would I
Like,
sit?
yes,
It's not.
Yes. That's you, that's all I do is you. Have you ever done PT before? No, never.
Yeah,
Or have you ever, I mean, how long has this been going on? Is this like a chronic, like a go situation?
Yeah.
Right.
Right.
I don't know.
Yeah.
That's possible, but I feel like it's like a Yeah. That would work out.
Yeah.
That's a good one. Yeah. And you're like, I was like, just like, you have the problem is figured out. It's just like you're like, I feel like you're really important, like exercises. Right.
I think it's.
Let's see. And it's all like back in here, and then it goes down back like a little. This side, okay? Is it ever going to the foot? None tingly or more pain? Tingly? Certain parts of the foot or the whole darn thing? I know. Then you gotta look and see like what's this back. Well, you know what I mean? Numbness and tingling in the leg. Numbness and tingling is usually something more related. Right. 9 times out of 10 it's going to be bad. And where do you feel that? The back of the leg?
Yeah, like hamstring in here.
Okay. If I do, well,
It's just about like back
Something
to
like
crazy. I'm not doing something that's
and then this makes it better a little bit anyway.
Yeah.
Just make it around a little bit. What's that?
No, I
It's like a good stretch. Oh, sorry.
Yeah.
Okay, the whole hip sort of lined up right now.
Oh my gosh, thank you for coming.
Yeah, right. I feel like I did it.
Nice to see you. Nice to see you too. Thank you.
While we're
Yeah. Well, let's just see, let's get a frame of reference here.
Yes.
Yes.
Yeah, so like,
Yeah.
Is it the same as the other side or different? Yeah.
Yes,
I feel way tighter. Please don't have it here. Hold here, don't let me press down.
Wait, what did she say?
Yeah. Any pain? Yeah. Yeah. Hold here.
That is amazing.
Right. Bend your knees. Good.
Yeah, you're
Good. Hold it there.
all of a sudden, but.
Yeah.
Oh, okay, very good. Hi, Chris.
And all of this has very specific, there's one, different glucose. Some rotate your knee in, some rotate your out, some rotate your back.
Well, she looked at my knee, one today, but I at different locations.
Man, I'm getting all the healthy people over here, that's not bad.
I mean, this is
Yeah.
fantastic.
But,
Yes.
Usually the rest of the year.
Yeah, now if you're in that,
Sure, do it.
like,
Your whole file is over, and it's like different.
Oh, well,
Yeah.
but not like the years out. Somebody years ago, that's what they were.
and is this not you're not, if it's very
Not
common.
as well, like, fertility, like, uterus or anything.
Okay.
You need a specific food, strengthening activation program, you need to foam roll these groups out, I have that crazy. You need to use it, yep, that's the thing, we always buy it, and maybe we use it twice, and then it just sits back, like,
Not
and it's not bad, but you stress these
And you work
out,
with
that we do, almost 3 a year. That's how much.
I mean, it's in the middle.
Like I tell everyone, I don't care how old you are or what you do, every 30 minutes you should be on producing.
I've been here.
Yeah, that sounds like your
Just so you have
SI.
an idea, like,
So your SI joint is very, very stable.
you just need to be set up with that, like I said, that kind of.
I crack mine.
Your body,
All
your
my
body.
So, it's not, right?
This is what, and
So,
maybe it's not.
with exercises like
I
just trying to sit back.
Yeah. Trying to do more elongated.
I totally agree. Yes, and absolutely, like automatically, right, and it's just a lot of stress ribs tucked in tissue, which is why flat, and even if that means modifying the range that she's going through, not, so back up. Yeah, bring it back up.
Those out 3 times a week.
Yeah.
Slowly get less.
And how old is she?
3 to 4 minutes.
Oh, nice to see you. Yeah.
That's great. Come on up.
Even more mindful of like keeping that back, trying not to fall into that.
So you can sit up.
Tension, which you do all the time.
So yeah, if you foam roll that more frequently,
Like,
then you'll drop too much.
that's great.
And then yeah, some more specific strength. So
it's
that's why, and I think
Glutes and abs.
you're relatively strong, you're doing a good job, I think, in your body in good shape. But that's the reason why that keeps going and coming down, some of those muscles in your leg are pretty solid. Then others you're like, see, nothing, so much juice.
You when it's first talking to you, and if you can kind of bring it in.
Yeah, absolutely.
And then.
But all of that is going back to that,
Especially
especially
very
informal. Okay, perfect. But like we said, you also don't need a script. Give us a call.
Just
Sessions.
It's nice meeting you.
Thank you.
Understand.
Like if you have a sign around,
Yeah, come on over.
just
What,
extra attention.
what time is it?
Your beer butt.
Your butt's gonna be sore for like a day.
Like the whole thing.
Alright.
Yes, so I'm doing everything.
So the shoulder, tell me about the shoulder.
Like, this is called hot, you feel things like routine.
Okay. Yes.